Welcome, everyone. I hope this afternoon finds you well. Welcome back to First Wednesday webinars at 1. This is our June session, and we're really excited to gather with you guys today and talk about reports, talk about the Prevention Learning Portal. Yeah, I'll give you a second to just follow the instructions on the screen. You can say hello in the chat, type in your name, your organization, where you're from. Great to have so many of you back. Alrighty. Well, as you can see, we've got a new style to our slides. So thank you, Lee, who is not with us today, but he did a great job putting these slides together. Just a few tips for the webinar. If you can introduce yourself in the chat, which I know some of you have already been doing that. Yeah, we want this to be as interactive and engaging as possible. So your engagement with questions, with chat, all of that is helpful. Also, if you have questions, you can use the Q&A feature, and we will have a poll at some point during this webinar to help us take attendance, but also just to hear your thoughts and gather some of your information. We also want you to know that this webinar is being recorded and our recordings will be accessible to you. We do have a folder where the recordings and any specific files that we share can be found, but you can also easily find our recording on YouTube. So feel free to check that out. And here are a couple QR codes. One will take you to the EPIS website. There's so many resources on there and a lot of great information that you can find. So definitely check that out. And like us on Facebook. We're on Facebook and Instagram. And we would love to connect with you on there. Would love to share more information about news and events that are upcoming, things that you need to be aware of, and all the things like that. And for our first Wednesday webinar team, hi, my name is Sophia Murillo. If you don't know me, I'm a meeting and training support assistant at EPIS. Elise and Lee, who are normally co-facilitators for this webinar, aren't with us today. They're having a lot of fun, I guess, on vacation. Jeff Colchin also isn't here with us today. He's the PACE project leader for PCCD. Phyllis Law, we do have her here. She's a senior systems change specialist at EPIS, and Mary Johnstun, director of survey services at Bach Harrison. And you'll hear from both of them today. And our special guest is Jordan Joyce. She's the program manager for the Prevention Learning Portal, the PLP. She's worked at EPIS for so many years and has just recently transitioned into this role. And she's going to talk to you all about the PLP. So I'll kick it over to Jordan.
Thank you, Sophia. Just give me 1 second. Okay, everybody should be able to see my first slide, the Pennsylvania Prevention Learning Portal. First off, I want to definitely thank today's webinar planners for inviting me to be a part of your group today. I'm really excited to be here and start sharing with you all more information about the Prevention Learning Portal. Today is going to be rather brief. It's going to be a very high-level overview of really what this Prevention Learning Portal, or PLP, is. But then I'll be back in the fall to do more of a deeper dive presentation and do a lot more features on what the PLP provides to you all. So you might be wondering, what is the PLP? So the Prevention Learning Portal, we are an online resource to really help everyone, literally anyone and everyone who accesses our site. We provide you with free resources and tools to really help build your prevention knowledge, skills, and enhance your overall capacity to apply evidence-based prevention approaches in your practices, in your daily lives. And you may be wondering, how can an online platform offer so much information, especially with, how large of a field prevention is. So I'd like to just highlight what the PLP does have to offer for you. So we offer free online courses that are asynchronous. We currently have a total of 10 courses on the PLP, and we're in the process of developing 15 additional ones. And 2 of those 15 are actually focused on the PAYS. And so I will certainly be excited to share more information about those 2 with you all when I return in the fall. But the first one, we're going to offer a course all about what the PAYS is, more like a PAYS 101. And then the second one that this team is working on, the additional course, is really to help everyone understand what to do with the data once you get it from the PAYS reports. And so that's really exciting for us to share with you all. Another area of content that we provide through the PLP are generalized resources through our e-library. And when I say generalized resources, I mean videos and checklists and various toolkits for you. We currently have only 8 resources on the e-library, but we have been dedicating a lot of time and attention to this. And we're hoping by the end of summer to really grow the library and have over 50 resources on this e-library for everyone to have access to. So we are constantly trying to learn what is valuable to the field and how can we expand what we have to really meet everyone's needs. The third component of content that we feature in the PLP are news and events. So if you're ever looking for prevention-focused workshops, trainings, conferences, this is the page for you. You could jump into our news and events page at any point and see what's happening virtually, what's happening here in Pennsylvania, or even across the country. And we try to put everything up there that comes across our inbox. So what's in front of you, these are the 3 areas of content that we're constantly building and growing through the PLP: our e-learning courses, our e-library, and our news and events. And again, I want to underscore everything is free. Now, while everything is free, in order to take any of our online courses, you will have to enroll and create your own account. And we do this for specific reasons. We want to know who our learners are and how are things going for you? What are we missing as far as areas of content? How can we improve what we have? And so we are genuinely just trying to make the PLP as best as we possibly can make it. And we'll have access to all of our learners to be able to find out information like that and improve what we're doing. So as I've already mentioned, we are continuously growing and expanding. We officially launched just October 30th of 2023. We will always seek to gather ideas from the field by utilizing this new online suggestion form. I have an image on the left-hand side of the screen that shows you, there's a little circle up there that shows you where you can actually find the suggestions link on our website. So you can click on that link to reach our online form. I can also pass these slides along to Sophia and anyone else and share these slides out so you can all have easy access to the link too that's embedded right here on the slide. But you can easily click on this link and share ideas with us. Are there additional courses that would be helpful for you or your staff, your coalition members, your school districts, anybody that you're working with? If there's any additional resources that would be helpful, let us know, and we would be happy to either find them or develop new ones so that we can feature them on the PLP and then everybody will have access to them. So please feel free to utilize this suggestion form at any point in time. And then before I wrap up, I just wanted to highlight a few things that are coming soon for us. A lot of this should be solidified by the time I'm back around with this group in the fall. But as I've already mentioned, we're working on 15 additional courses that are in development. We are going to significantly increase the number of e-library resources within that part of our PLP. And we're actually also working on a new filtering tool, because as you can imagine, if you jump into a web page and you have 50 plus resources to sift through, we want to be able to offer you a way to filter through everything that we're offering so that you can more efficiently find exactly what you're looking for and what applies to you. We also are going to soon launch PLP social media pages, including a YouTube channel. And we're also developing a promotional toolkit. This will be an additional page built on the PLP so that you all have easy access to grab promotional items and feed them out to your communities. So flyers, different imagery that you can grab and put into a newsletter or an agenda that you're pulling together. Just help us continue to spread the word that the PLP exists and get this information out to all of the communities across Pennsylvania. So that's my quick overview, but here's my email address for the PLP. Please feel free to reach out to me if you have additional questions or if you want to talk any further about what the PLP is all about. Feel free to reach out to me anytime, but I'm also going to stick around here for the remainder of the webinar today if you'd like to also send me a quick chat. All right.
And Jordan, there was a question in Q&A.
Oh.
Are the CEUs applicable to LCSWs or LPCs, or is it Board of Education specific?
So we offer two areas of continuing education. So the first one is for Act 48. And Act 48 credits actually is applied to every single one of our courses that exist right now on the PLP. And then the second area of continuing education that we offer is for the National Association of Social Work. So as long as your credentials fall under the social work field and you can go through NASW to receive continuing education, most of our courses qualify for that entity as well. And we actually have those highlighted on our e-learning page, which courses that applies to, as well as once you register and see all of the courses in your course catalog on your dashboard, you'll be able to see again, which courses you can take that it applies for your professional development. And I'm sorry, I wasn't paying attention to the chat, so I missed that. Any other questions? Okay, I'll pass things back to Sophia.
Awesome. Thank you so much, Jordan, for all that information. I think we're all really excited for the things that are coming out on the PLP. So that'll be exciting to get back in the fall and see what has changed. So back to our presentation today, we're going to be talking about the PAYS full reports, which are available. If you are on our EPIS newsletters, we do, I did share about that last week, but they're available if you would like to access them. And now I'm going to set up a poll. So if you could take just a couple seconds to complete this poll. We want to know if you've received your 2023 full data report. Just take a couple seconds to do that. It looks like most of you have said yes. Some are not sure. Less than that said no. Maybe about 30 more seconds. Alrighty, well, I think our answers have slowed down, so I'll end that. Great, I think our team would love to follow up with some of you who said no, so stay tuned for an email from us. And now I will kick it to Phyllis.
Hey everybody, glad to be with y'all today. It's been a while since I've had the opportunity to be able to join y'all. So what I'm going to do today is what I would like to spend a little bit of time. I guess we should have also asked the question, how have you had a chance to start digging into your report? One of the things that, this report, there were some edits, there were some changes, and I'm going to walk through those with you today before we hand it off to Mary, and she'll spend the bulk of the time sort of walking through the report of what it looks like. And she'll touch on, one of the big changes is if you haven't had a chance is there were some reordering of the content a little bit, which she'll dive into. And we hope that, that edit was made to really kind of hopefully just make the flow of the content a little bit more fluid, if you will, and make it make sense a little more clearly. One of the things that you will find at the end of your report in Appendix B is this rather long laundry list of edits to the page this year. There were some questions that were added, there were questions that were deleted, and there were also some questions and response edits and adjustments that have happened. What I've done is I've taken that Appendix B that could be a little bit daunting if you're looking at it, and I've created a little bit of an Excel sheet. Sophia, could I share my screen real quick? Awesome. And I will say all the information that you see in Appendix B is what you're going to see in this Excel file. I just try to make it a little bit more digestible. And I pulled out, as you'll see here, there's 3 tabs. There's one's questions added, removed, and then some reworded or response edit. I'm not going to go through all of this today because I really want to showcase Mary and spend the time going through the report with you. But I thought it was important really to kind of think about some of the additional questions. One of the things we really struggle with as part of the survey development team is thinking about, excuse me, the importance of the questions we're asking. We really this year, those of you who know me, I'm usually the one who's like, no changes, don't change things. But our team really does believe that we're in this space of evolution. We really do feel like that this year's some of the questions we're adding and taking away and movement within the survey really is kind of a bridge into some more deeper dive edits that you will see in the 25 and 27 administrations. But the first thing we wanted to do was make sure this time, and sort of this priming the pump to the edits, if you will, was to really include some questions that did come from the field that people were asking for. And these were like lifetime use of vaping. One of the questions that I think was really great that we added was, overall, my mental health in the past month has been good. And here's your response of it. Big no, little no, big yes, little yes. This idea of really kind of showcasing, yeah, I feel like I've been okay. We tend to sometimes focus on sort of the how bad are you feeling, but it's good to also know how good you're feeling. We also have asked that I feel like is a really great question about, if you felt sad or lonely in the past month, who did you talk to? And then you can select all that apply here. And this was a good list, and it was really interesting. I will say I've sort of been diving into a lot of several of the reports for school district and the county levels for several counties. But it's interesting because we're starting to see some trends there of where kids are really reaching out to. And that's from big districts, small districts, rural, urban, all different types of districts. So it's really interesting, I think, as we start to learn more from that. We've also asked the risk of harm around vaping and e-cigarette use. That had not been asked in the past. We didn't feel before that we were really necessarily ready for that, but that, along with the lifetime use, was important. And then we asked a couple of other questions as far as perceptions, attitude, and then also, where was your source of your vape? So again, just using the time. Vaping, we added a 30-day vaping. We added a couple of administrations ago because it was an emerging trend. So now we're kind of diving a little more deeply into it, and that's what we try to do with PACE, is really stay on top of things. Now, in the second tab, you'll see here, again, we've removed some questions. And one of the things you'll note here is that this second or the third column here will really give you an idea of, kind of the rationale of why we decided to make an adjustment or remove it or whatever. But the two focus areas where we did, the three focus areas where we did remove the question was because it was either answered somewhere else or there was very, very low response rate or low prevalence rate. So we definitely added about perception of cigarette use. We did because it was duplicative to another question. We've also we removed the gang involvement questions. Again, low prevalence, didn't get a lot of response. And then we had a little bit of a duplication as far as were you attacked at school, and these that were removed were with a weapon. So again, just a little bit of an adjustment there, but it could have some issues and this have impact on any goals you may have set. But this is where we get to our last call or our last tab here, where we're really focusing on edits to questions and any rewording. I really want to encourage you. You will see these noted in your as you're going through your page and looking through, and I know Mary will showcase this as well. But what we tried to do here was really try to, again, make it a little more digestible. What were some of the edits that made a difference? As an example, this is just at the very top here, we changed mother or father and replaced it with parent/caregiver. Now, will that have an effect on trend data? Probably not, because kids are still going to kind of be in that space. Now, as you look down here, there were some questions, and I've highlighted these rows in yellow that were that there would be an effect in trend possibly. So we really want you to be cautious with, when reporting these out and definitely letting folks know. And this is a good example of in 2021, the question of lifetime use around all substances except for cigarettes and smokeless tobacco were how many times. In 23, have you ever? So trending that data is going to be difficult, right? So just need to, I'm not going to go through all of these again, just want to kind of let you know that what we've tried to showcase here are thinking about small edits that could have big impact when you come to reporting. Definitely, we are here to help you kind of if in that space, if you're like, should I talk about this in a different way, or what exactly where we should go? We're always here to help with that. But definitely, I feel like when the key here and really what my big message is that, as you're looking at your page and as you're thinking about your data, just really look at what's in there. Take a look if there's a change. Take a look, take a step back with your lens. If it's something you've been tracking over time, you may have to make a bit of an asterisk in your tracking, right? Because things have been changed. So please know that, again, this is not something we were trying to, raise up, but we do agree with Mary at Bach Harrison and her team and our whole team in Pennsylvania around looking at developing this. This is not about making the data difficult, but it's keeping it relevant. And it's really evolving it into a space, because we haven't made edits in probably at least 4 or 5 administrations that we've made big edits. So again, we really do believe it's time, and we are always here if you have questions about, now what does this mean or what does it look like? So I'm going to hand it over to Mary now, and she's going to, as I said, kind of walk you through your report, walk you through the different types of reports and just some of the cool stuff we have out there for you. So Mary, all yours.
Great, that was a wonderful overview. Thank you. And as soon as I get the ability, I'll share my screen. There we go. All right, give me 1 second. Are you seeing my screen? Oh, here we go.
Not yet.
Okay. Now?
Yep.
Okay. Wonderful. All right. And you're seeing like the website and then our profile?
Yes.
Great, thank you. All right, so Mary Johnstun, the project manager for the Pennsylvania Youth Survey. I'm here to talk about where you can find your reports and then how to dive in. So my hope is that even if you are a very well-seasoned report reviewer, you'll get something out of this. And in general, if you're a brand new report reviewer, this will just serve as a good guide to walk you through the reports, understand where to start. We know that our reports can often be really overwhelming, especially if you're not a data person. And even if you are a data person, there's just a lot of data here. So I'm going to walk you through my tried and true sort of process for diving into any report, and hopefully that will help you. So first, I'm going to show you where you can find publicly accessible reports. So if you go to the PAYS website, you go to the 2023 page. If you go down to 2023 PAYS results, you're going to find publicly accessible county reports. We're able to post a county report when we have at least 2 school districts or LEAs that are a part of that. So here you can find publicly accessible county reports. We call them just the regular summary report, and then what we call an all questions by grade report. And I'll talk about kind of the difference between these 2 reports today. So we have these posted for every county. This is also the site where you can go and find the early reports that we released, the statewide report, and then again, just kind of, there's more reports coming soon. Okay, so for the 2 reports that we have what we call a profile report, or often we call this a summary report. This is where you're going to start. This boils down the information into kind of bite-sized chunks by topic. It boils the data down into kind of data points that you're likely tracking or are going to find most relevant. It also has a lot of language to walk you through it. The all questions by grade report is a report that really just has a lot of data. So this is one where I would not start with all questions by grade report. This really is more of a supplement to the main summary report. And so we'll just go ahead and start there. So for those of you that marked no or not sure to the poll, and that was a great poll, that would have been for district level reports. So our process for releasing reports, and reports were released on April 30th by email with reports attached as attachments. Reports were released on the April 30th with the superintendent or the charter or private school administrator as the main recipient. We also CC'd any authorized data user. So if you were a survey coordinator, that your superintendent gave you access. If you were listed by the survey coordinator or by the superintendent in the agreement form as an authorized data user, you would have been CC'd on there. So those went out April 30th, a lot of emails went out, and we were able to track bounce backs as best we could, at least for superintendents. We've also been fielding requests. If you are a district in which, honestly, you didn't get it on the 30th, we've heard from many of you and have been responding to those by forwarding those reports again. If you are in the boat where you know you're an authorized data user or superintendent and you haven't received it already, please go ahead and put your name, your role or your title, and your email in the chat. And Ariana, who's a project manager on our team, will be keeping track of those so that we can get them to you. If you've already requested one and we've said that we've sent it, you might want to loop in your IT staff. So we have heard from a few districts that because there are 2 attachments and they're not necessarily small attachments, some of them are getting caught up in spam. Or in your spam filter. So you might need to reach out to your IT staff and ask them to release those. And so usually when an IT staff member is rolled in, then honestly, things get right back on track. So just note too, we're here to help. You can always reach out to me, Mary at Bach-Harrison.com or Ariana at Bach-Harrison.com, and we can help you out. Okay, that said, let's go ahead and jump into these reports. So this is your profile report. I'm going to use Adams County as an example. This is one of our publicly accessible reports. And Adams, I'm sorry, I think you're always the example I use because alphabetically you're number 1. So that's the only reason I'm using this one. But in general, I want to show you a county report because this is the best example of what a district might see. And I'm not allowed to demonstrate or show any district's data. We can consider the district to be the owner of that data. A county report will show you kind of how we display state level comparisons. And so it's kind of a good imitation of a district level report. So let me walk you through some of the features. Go ahead and of course, ideally you would read it cover to cover. But as you can see, this is 118 pages. And we know that the chances of you like snuggling up with this in front of a fire with a warm cup of hot chocolate are like slim to none. So in general, all of the data is really helpful. If you're a brand new user, I would encourage you to go ahead and go through it start to finish. In general, one of the first things you're going to do is just to get familiarized with all of the different topics that PAYS covers. And PAYS is a great example of just a really comprehensive survey that covers data on a plethora of topics that's going to help so many different types of data users to really get the data you need to move your work forward. Demographics, there's a demographic section, and we'll talk about how important it is to kind of study your participants before you jump in. There's a section on substance use, on mental health, gambling, climate and school climate and safety. We know there are other school climate surveys that exist. The PAYS allows you some really great trend data and also some really good tools to dive in even more on those topics. We'll talk about indicators, or there's a section on indicators of risk, anything from stressful events and sleep, perception of risk, to things like, availability of substances and handguns, laws and norms favorable to use, etc. And then there's a section at the end for the risk and protective factors, which if you or within the field of prevention, this is the data that feeds that kind of CTC model of risk and protective factor focused work. And those data will help you there. If you're a drug-free communities recipient, here you're going to find a table that's going to give you exactly what you need to plug in to that reporting system. There's a section on survey methodology, a section on kind of where you can go for more information, and then also a new feature, which is a listing of the schools and districts in this report. This is actually something we've had before, but we're presenting 3 years of data for this. And I'll kind of show you what that looks like at the end. Something new this year is that this profile report these are clickable links. So let's say you want to go straight to mental health. It's going to jump you straight to that mental health section, and you can go ahead and jump in that way. To return, you're just going to have to go back to the top. But in general, that is a feature that we're going to use this year. Okay, let me jump into kind of my steps for going through a report start to finish. And this is actually what I do when I am preparing for like a local level presentation or any type of presentation of findings where I'm using the report as my guide to prepare and maybe create some additional slides on my own or things like that. So while you might be very tempted to jump right to the topic of your choice, I strongly suggest a best practice is to slow your roll a little bit and just focus on understanding who took the survey. So understanding who participated in the survey is 100% the best way to start, because you don't know really what your data are until you know who is actually represented in it. So you're going to start there by looking at page 6 of the report, where we've got participation by Pennsylvania youth. This extends into the demographics section. So let me show you kind of what we're talking about when I say you're going to kind of study your characteristics of participants. So first you're going to see, in general, you're going to see, and this is again a county report, your county, the number of surveys we collected compared to the number of students enrolled. You'll be able to see your participation rate, and you'll be able to compare that to the state. And then likewise, when it comes to, when it comes to just sort of the actual schools that are participating, you're going to get that down here as well. So let's focus on this first one. If you're a data person too, you're going to find some kind of confidence intervals there to guide your work. So when I look at this county level report, I can see that we have really great participation in the 6th grade. 86% of students enrolled participated. Likewise, in the 8th grade, participation went down a bit. In the 10th grade, we've got 72.2% of students participating. In the 12th grade, things dropped down even more. We have just 54.9% of students participating. This is still a majority of students. We're always hoping at every grade level, we're seeing above 60. That said, this is still a majority of students, and ultimately, serving the 12th grade is a challenge. If you are an administrator or one of my survey coordinators, you know this 100%. It is really hard to find a core class that all 12th graders are taking. It's really hard to nail 12th graders down. Many of them are on work release or home study, or they're taking college classes off campus. So this is really common, and you can even see that for the state level data, we also see that at the state level. Participation across this Commonwealth of Pennsylvania is 60.2%. And you can see for this county, your participation was actually higher than what we saw at the state level, which means you had a really great administration. In general, sometimes we get questions about, well, these percentages aren't 100. How can we be confident in the data? In general, you just need to accept the fact that we're going to have parent opt-out, we're going to have students opting out. This is a voluntary survey across the board. We'll also have students that were just simply absent on the day of the survey, or were gone due to having an activity or things like that. So in general, we just strive for the best that we can, but knowing where these are helps you to interpret the data. So if you see that these are 30% across the board, you might want to say, okay, well, let's figure out who actually did take the survey, and maybe kind of question whether the data are representative of everyone, or if they're maybe representative only of the students who took the survey. Likewise, you're going to study your demographics. So these are really important because representation matters, right? If you are a community where 40% of your population is Hispanic Latino, but only 10% of surveys were from Hispanic Latino students, you would need to understand that your data might not be representative of the entire population, and you have an underrepresentation of a very key population within your area. So kind of scanning through here to kind of focusing in on this number percent column, and you would just say, okay, does this look like our population? So for example, here we can see for this county, 51% of participants were male, 47.1% were female. This is a pretty even split. In terms of the percent of participants that were marked that they were, yes, Hispanic, Latino, or of Spanish origin, we've got 18.3%. Again, just kind of like checking in with the district, with the enrollment numbers that you have, and just saying, okay, does this align with what we have in terms of our enrollment is important. And then likewise, just taking a look at these different participation rates by different various race ethnicity groups, and just checking the representation there. So hopefully you're kind of seeing like, yes, this was not the funnest review, but this really is the place to start, because once you you're really confident about who took the survey, it's going to help you to be really confident in your analysis of your findings, and then also your interpretation of those. Each section is really pretty simple. So here, let me walk you through a substance use section. You're always going to kind of start with a page that's going to define some things. It's going to tell you what we're looking at. It'll tell you kind of what we're measuring, and kind of defining what things are. So for example, what is the Bach-Harrison norm that we refer to throughout the report? What is monitoring the future, or MTF? So really kind of, again, if you're brand new, especially taking the time to understand what these things are, what the acronyms are. This report really is designed to give you everything you need to really understand the reports. If you do jump right to the charts and you're like, what is BH? What is the BH norm? What is MTF? Just know that the answer is I would say 99 out of 100 times in the profile report. And the great thing about having this in an electronic format is you can use the handy dandy, Control F find feature to help you kind of find where things are. Within each section, we're going to break it down into subsections. So for example, substance use, this section starts with a discussion of high prevalence and early initiation drugs. You're always going to have a page like this where we're really explicitly providing the actual question wording that we use. We're providing, this is just kind of where you can see what the question was, because within the chart, you'll see that there's a lot there already. So we're only able to abbreviate kind of those labels. So this is where you would see kind of the full question. This is a really prime example of just a profile report chart. And you'll see this style of chart over and over and over again. So really taking the time to kind of get your bearings with this type of report is really important. I like to say dive in slowly and strategically. So I think it's important to kind of come in with an idea of what are the goals that you want to accomplish. Is it to, just parse out the data that you need to build into a report or a grant application? Is it to study trends? Is it to identify maybe potential changes in the data that might help you to identify, a different population of students that's at risk for a certain thing? It might be all of those. And in general, I think with data users, you have a lot of goals. But taking stock of those will help you to strategically look through each one. And I'll talk about what that means in just a second. So again, we're kind of getting your bearings. So starting here, you'll see what it is we're looking at. Here we're looking at early initiation and high prevalence drugs, and we're looking just at lifetime use. So lifetime use is a measurement of any use in a student's lifetime. We kind of consider lifetime use to be a measurement of experimentation. Lifetime use will always be higher than 30-day use. When we look at 30-day use, which we can see here, and you can see that the bars are significantly lower, this is any use in the past 30 days. So this is more of a measure of regular use. So let's go ahead and park here for a second, because I think oftentimes that regular use is more meaningful, and it's often what we report in our reports and grant applications, because these are generally usually the students that are in most need of our attention. So when it comes to 30-day use, it's important to note too that 95% of the surveys were done online this year, and that surveys included skip logic, which allowed us to make sure that only students who indicated that they had used in their lifetime even saw this question. So 30-day use, because of that skip logic, only students who indicated that they'd used this substance in their lifetime were even asked about 30-day use. And it was a great method to go ahead and shorten the survey a little bit. Okay, so now we know what we're looking at. Let's kind of study, what we're looking at, like what we're really seeing in this chart. So we're seeing alcohol, 30-day use, marijuana, inhalants, vaping, e-cigarettes. And again, if you wanted to look at those full questions, you would just go back to that page that we were looking at before. Taking a look at what the scale is. This is a scale of 0 to 100. Some of our, for example, really kind of the riskiest and least used substances, you might see a scale of 30 there, or 50. And that's going to help you. Understanding that is really important, because a bar here, for example, on a 100% scale, it might look the same as it does on a 50% scale, but the numbers are actually just drastically different. You'll see in our profiles, we're showing 3 years of data, the most recent 3 administrations. This is so we can really report a lot in just kind of a small amount of space. You'll also see that we're showing different grade levels, so grade 6, 8, 10, 12, and then all grades combined. Note that if you're a district, for example, that didn't survey the 12th grade or the 6th grade, that your roll-up will be of all the students who did participate in those grades. Likewise, you see here, we've got a little triangle. This is for monitoring the future. This is a comparison against a national average. And then you'll also see here, there is a dot, and that's a comparison against the state. So if this is a county report, but if you're a district report user, you're going to just kind of see where you are against the state. Now that you have kind of the specifics in mind, these are the 4 things that I look for over and over and over again when I'm really analyzing a report or diving into the data. I look simply for what's high and what's low. So for example, scanning over this, I'm going to see that, cigarette lifetime, sorry, let me go back to this 30-day use. Okay, so 30-day alcohol use. Students within this county are more likely to be using alcohol in the past 30 days than marijuana. This is not always the case. In many areas of the nation, marijuana use has surpassed alcohol use. So I know that, okay, alcohol use in my community is higher than marijuana use. However, vaping use is really competing with both of those things. Also, I'm looking at just kind of what the differences are by grade. So I can see for alcohol use in the past 30 days, it's simply higher than every grade. This is not uncommon when it comes to substances. Inhalants, perhaps you might see data peak at a younger grade where access is an issue, but in general, this is not a common. So you're just looking at what's high and what's low. You're also looking at changes over time. So we're looking at 3 years of data at a district, at a county, let me back up. At the state level, our data is so robust that we're looking for changes of just 1% or often even less than that for it to be a statistically significant change. At the county level, we're looking for changes of about 2 to 3%. So for example, this jump here from the 6th grade, which you can see down here is a jump from 4.8 to 5.4. I would say this is not statistically significant for this county. However, this decrease here for 12th grade, which is a decrease from 29.6% to 22.8%. That is higher than 3%. I would say that is a statistically significant change. So you're looking for changes over time, but with that rule in mind. For districts, it depends on the size of your district, but you could be looking for changes of up to 5%. So oftentimes I think we take a look at, honestly, like even big jumps like this, and they cause us a little moment of panic, and that's completely normal. But just keep that general rule in mind. Is county level, you're looking for changes of about 3%. At district level, it could be 5% for it to be a meaningful and statistically significant change. So that's what's high and what's low, what's changed over time. The third is, where does your data fall relative to the state? So just kind of eyeballing the data across, you'll see this is always aligned with 2021 data, but this is a 2025 or a 2023 measurement. But in general, just kind of eyeballing this, I can see, okay, well, it looks like, honestly, data for Adams County is really similar to the state for at least the 6th grade. In the 8th grade, that's where students begin to kind of be higher users than in comparison to that state average, especially in 10th and 12th grade, where Adams County data is significantly higher than the state. Likewise, the fourth thing is you're going to look at your data in comparison to the national average. So you're going to say, okay, where are we at in relation to the state? Where are we at in relation to the nation? And you can see, for example, for marijuana, the marijuana use, you're really similar to the state across all grades. You're actually lower than the nation. So your data for Adams County, you're kind of on par with the state for marijuana use, but lower than the nation, and that's definitely a win. What you should be concerned about are areas, for example, like this for vaping and e-cigarette use, where you're both higher than the state and the nation. If you like Adobe Acrobat, and I'm a big fan, let's see, you can use the comment tools. Let me just show you kind of how I use it. I often will use like the highlighter tool or the add text tool to just do some really quick flagging. Let's say I want to focus on kind of flagging changes that I think are pretty positive. For example, I'm going to, let's see, I'm going to flag this decrease. Why isn't it letting me highlight? Sorry, y'all. Okay, well, letting me do that. Maybe I'll flag that as a positive. Maybe I'll flag, honestly, because we're lower than the nation, I'm going to flag all of this as a positive. Maybe I'm going to say, okay, what are some troublesome data? I'm going to flag these. Likewise, you can just use like the free highlighter tool to just kind of maybe do some markings or referencings that allow you to just really quickly record some notes. This might be something where you're like, man, Mary, don't slow me down. Let me just keep working. But the thing is if you strategically and slowly do this, by the end of the report, you will have a lot of patterns and takeaways. And so documenting what is high and low, what's changed over time, what's higher than the state and higher than the nation, consistently, by the end of the report, you might be able to say, you know what, our 10th and 12th graders are not doing well. We should probably focus our prevention efforts there. And you will know exactly which risk and protective factors to dive into. You'll have a really good sense of where you should start. And so just kind of making whatever notations you want is a really good way to, at the end, be able to have identified some big and exciting takeaways. If you're a paper and pencil person, which I will admit, I'm pretty old school and I am still there, just get your highlighters. Get a green highlighter and an orange highlighter, get a pen, and honestly just do a simple, just kind of like mark it up. And the same thing, you will see patterns by the end. Okay, so that is what I would suggest. Let me just kind of cruise through. You're going to have all the sections. I want to really quickly show you some tools at the end before I show you the all questions by grade report. So starting with the risk and protective factor section, this, especially if you're new to the model, this is going to give you a really nice overview of what the model is and how it works. This is the predominant model for prevention across the Commonwealth of Pennsylvania. You're going to see a list of questions for each risk and protective factor. So let's say you were looking in that risk and protective factor data and you notice that your data for, actually, let me close my comment tools. Okay, for laws and norms favorable to drug use, that was actually really high. And you're like, well, what does that mean? What were the questions that students were asked to be able to assess or determine kind of that risk and protective factor scale? And you'll see here the individual questions that fed into that. This is where I would honestly, when you look especially at your risk and protective factor data after you've marked it all up, this is where you would turn to the all questions by grade report to dig in deeper. So let's say hypothetically the laws and norms favorable to drug use was one of your highest risk factor scales, and it had also showed an increase, and it was higher than the state and the nation. And you are like, man, I really need to figure out what's going on with our kids in that area of their lives. Here, you could take a look at the questions that fed into that, and maybe you would say, well, when it comes to how wrong most adults over the age of 21 in my neighborhood think it is for kids to do any of these substances, maybe it's one of these items that's driving the data. So this can often help you to look at things from the big picture look and the profile and really dig down into the all questions by grade report to dive in. And I'll give you an example of what we're looking at there. Another thing I want to really quickly point out, we have some great appendices. So for example, in the survey methodology section, this is going to go into a lot of those changes. This is more high level, kind of like high level overview. Phyllis's tool, which will be shared out, that is definitely a more granular look at what the changes are. And then do not forget to check out the for more information. And then finally, Appendix D, that's where you will see for the past 3 administrations, which districts were involved, which schools were involved, et cetera. Really quickly, I know we're running out of time, but the all questions grade report, you can probably see after we looked at the profile report, is the profile report gives you, for example, who used alcohol in the past 30 days and who did not. It doesn't tell you the number of times, it doesn't tell you how often. And likewise for the risk and protective factor scales, you are able to see the percent of students who are at risk for engaging in problem behavior due to laws and norms favorable to substance use, but you're not able to see like how those individual questions that fed into that scale, what those look like. Likewise, you're not able to tell the number. So oftentimes an interesting or kind of a change in the way that we can vocalize or connect with reviewers is if you're talking to a parent and you say, you know what, 10% of our students have considered suicide in the past year, they might say, oh, wow, that's high. If you can find the actual number that maybe equates to 100 students, and you say 100 students in our district have considered suicide in the past year, sometimes that number can speak louder than a percentage, and sometimes it's the opposite. So this all questions by grade report, this is really designed to allow you to really drill down. and to kind of help you understand more of those questions that you have when you were looking at your profile. So this is where you go after you fully reviewed your profile. I would not start here unless you are 100% wired to just very meticulously look through this. So let me show an example of kind of what we'd be looking at. Again, you're kind of looking, we have data by grade 6, 8, 10, and 12, and then in all grades combined. These are not weighted data, so these are the actual students who participated. You can see that everything is organized by, for the risk and protective factors, is organized by scale. So for example, low neighborhood attachment, you're going to see the 3 items that are part of that scale. Likewise, you're going to be able to kind of look at the numbers and percentages by grade for those. Something else, let me show you an example of, let's say you want to understand your substance use even more. You might, for example, this is lifetime 30-day use, and here we're going to look at lifetime use of beer, wine, or hard liquor. You're going to get the full question there. You're also going to get every single response option. So again, in your profile report, you are only getting those that said yes or no. And you can see here another thing to note is that we have a lot of data that says NA here. And that is, in general, anytime you see that, please take a look at the footnote. This is going to flag a question that was significantly revised from 2021 to 2023. So a lot of the things that Phyllis was talking about. And the main reason why we're NAing it out here is because it's not an apples to apples comparison. In 2021, we asked about number of times of use. Here we're asking about, we're using language that students are more likely going to understand in terms of asking them, well, was it never? Was it once or twice? Was it once in a while, but not regularly? Was it regularly in the past or regularly now? But still, this allows you to really dive into the frequency of use. So for example, in the profile, maybe you saw across 12th grade that about 50% of your students had used alcohol in the past 30 days. Well, are they using a lot or are they using a little in the past? And I'm sorry, this is lifetime, in their lifetime. You can see when it comes down to boiling it down, well, of 12th graders, about 1 in 5 have used it just a couple of times, once or twice in their lifetime. You have about 1 in 4 12th graders that have used it once in a while, but they're not using it regularly. And then we've got about 3.1% that have used it regularly in the past. And you've got 1.3% of your 12th graders that indicate they're using it regularly now. So this allows you to, again, kind of drill down, understand the data a little bit more, and really identify, help you to tell a story of your data. Because honestly, if we were just simply to say, okay, 50% of our 12th graders have used at least once in their lifetime, that's different from maybe you're writing a grant that really focuses in on really very high frequency substance users. You could take a look at that. So I have gone way over longer than I wanted to. Are there any questions that have popped into the chat or Q&A that I can help with that we could look at together?
There's one in the Q&A, Mary.
Okay.
Is there a way to double check or confirm the results of a specific question?
That's a good one. I mean, you can always ask us, but the thing is these data are clean, they're vetted, they're analyzed, and honestly, usually at this point especially, it would take an incredible error that would have to apply to every single report for it to actually be an error. So you can reach out to us and just say, hey, can you double check this? But it is usually accurate, or at least what students reported. So that's another thing. This is a student self-report. We're asking them to report honestly and openly. This is a big part of our student and subject protections. So I don't know if that is a good answer to your question, but that is usually the process. Any other questions? Okay, I'm going to go ahead and stop my share. You're always welcome to reach out to me if you, or Ariana, if you have any questions about any of this. EPIS is an amazing resource. to help you to really dive into your data and to take it further. Your local level prevention guides are also a tremendous resource to help you to dive into your data and understand it and apply it to really take it and understand what you can use it for. So I'll turn it back over to Sophia.
Thank you, Mary. Thank you for walking us through those reports. That was a lot of really good information. And if anyone else has any other questions or wants to dig deeper, please don't hesitate to reach out to our team. I know we're at the top of the hour right now, so I just put the link in the chat for our evaluation. If you can take a moment to answer those couple of questions, that would be great. It helps us plan for future webinars and helps us meet your needs. Yeah. We look forward to seeing you guys at the next First Wednesday webinar. And thank you for everyone. Thank you to our panelists who are on today. Yeah, it was great to chat with you guys.
And Sophia, we won't have another webinar until September. Is that right?
I believe so.
Yeah. Just as a reminder for everybody. Happy summer.